On the Health Watch, the mortality rate for Black mothers in the United States is not improving. A Centers for Disease Control study shows that even though maternal mortality rates have dropped overall in the U.S., Black women are still dying at a rate that's nearly 3.5 times higher than white women around the time of childbirth. Joining me now to talk about this really troubling trend is Dr. Charles Lampley with Mount Sinai Hospital. Doctor, thank you for being with us.
Thank you for having me.
I want to start with this data from the CDC from 2023, and I know that it shows that the mortality rate for Black women went up to 50.3 for every 100,000 live births. The report said that wasn't statistically significant, but every life lost here is significant. So why is this racial gap growing?
Well, you know, we had barriers to care that existed before COVID. And actually, when COVID occurred, you actually saw excesses and you saw those rates rise because the pandemic exacerbated the problems that we had. Now that we've gotten through the pandemic, we haven't necessarily addressed all of the barriers that still persist. And so now we're still seeing those ongoing consequences.
What are some of the barriers? I'm curious specifically to start if age is a contributing factor or prenatal care. Does that play a role?
Yeah, I've seen, well, you know, a number of hospitals that deliver maternity care have closed in the Chicagoland area. So the distance that mothers have to go, African-American mothers have to go in order to receive timely care is increased. That's a barrier. Transportation issues, childcare issues, all sorts of other social determinants of care types of barriers. On the other hand, when I've seen and managed mothers that when we do have timely care and the opportunity to intervene, their outcomes are very good. But the issue is getting into care, getting access to appropriate care, and removing some of those barriers that exist.
I know so much of the work is often on the woman, on the patient to advocate for themselves. So I'm curious, with those barriers in mind, what do you tell pregnant women of color about how they can advocate for themselves or ask for help to avoid a terrible situation like this?
Well, you know, fortunately, there are organizations such as West Side United and Sinai and other groups that are there to sort of help overcome some of these barriers, help counsel and advise moms. When they arrive to me in my care, what I do is I try to connect them. We try to outline what can we do to best help you and your child have a healthy outcome, and what we need to do, and then what are some of the barriers. And that's when we are able to connect them with agencies such as you know, Sinai Community Institute and some other members of the West Side United to help overcome some of those barriers. And when they are able to participate in their care and there are no barriers, they can do quite well.
Well, thank you for making that possible for the patients that you connect with. I know it's having an impact, and we appreciate your insight, Dr. Charles Lampley with Mount Sinai Hospital. Thank you again for your time.
My pleasure.